Good morning, everyone. Thought a little change of scenery would be good for the media. Bring you outside. A nice morning. I'm delighted to be standing here with my colleague, Senator Murray from Washington, a member of our committee, and Ron Pollack. We've been focusing each morning on aspects of this health care issue, and it deserves being repeated every day that the present situation on health care is not just unacceptable, it's unsustainable from an economic standpoint. You cannot have as much of our gross domestic product being consumed by healthcare costs and mounting every day in this nation and expect our economy to thrive and prosper in the years ahead. This is the issue that makes our economic recovery in the long term the most difficult if we don't address it thoughtfully, bring down costs, increase that accessibility, and produce a far better quality system than we have today. The system is broken. I don't know of anyone that believes otherwise. If you're one of the 50 million with uninsured, you don't need a lecture about it. If you have insurance, you're worried to death whether or not the costs are going to continue to mount, making it impossible for you to sustain it, or whether or not the coverage will be there at all if a crisis hits and you're going to get the benefit you need to take care of your family or not. Remember, at any point during this given year, 80 to 90 million of our fellow citizens are without health care for some period of time. 80 or 90 million. Every single day, 14,000 people in this country lose their health coverage. 14,000 people a day. And so the issue of coverage, of being there, to be there at that moment of crisis is absolutely critical for people.
You know, no matter where I go in my home state of Washington, people come up to me and they tell me personal stories about how health care has impacted them. And too many people tell me today they can't get health care when they need it, they can't pay for it when they do, and they aren't given a choice in some of the most personal and important decisions in their entire lives. We know our system is broken today. We know we need to fix it. That's why we are working so hard in the committee, here in the Senate, to make sure we protect what is good within healthcare today, we improve what's not, and we provide access to the care for millions of Americans, including more than 830,000 in my home state of Washington. Those numbers are what you see on the ambulance behind me that Ron will talk about in just a minute. Those numbers are about real people. They are about a young boy in my state. His name's Marcellus Owens, who I met just a couple of weeks ago, 10 years old, who came to a healthcare rally we were doing and told me about his mom. 27 years old, single mom, working hard to take care of her young family, going to work every day, got sick, got sicker, started missing work, and her employer told her, you either make up the sick time or you lose your job. She lost her job, and with it, she lost her health care. Because she didn't have health care, she couldn't get in to see a doctor, and she died, leaving Marcellus and his family without a mother. Marcellus said to me, please fix this for me and for all the other kids. Marcellus, one of the numbers on there, extremely telling story. For all the people we're hearing today who say this is not the time, too hard, too difficult, I think about Marcellus and all the other people I have met who've been impacted by the system that is not working for them today.
Thank you, Senator Dodd. Thank you, Senator Murray. Those of us who have worked so hard for years to achieve significant health care reform, we're heartened by the progress you're making in the Senate Health Committee. No one said it would be easy, but we really appreciate the hard work and tenacity of your leadership, so thank you. Today, this ambulance and this ticker, the losing coverage ticker, symbolizes how significant the harm is for each day that we delay health care reform. It is clear that for those people who are uninsured, this is really an enormous tragedy. As health costs grow, as people have lost their jobs, as businesses get priced out of the health care they used to provide, more and more people who used to take health coverage for granted are being priced out of the health care and are joining the ranks of the uninsured. Now, this ticker that's behind us is based on a peer-reviewed journal article in Health Affairs that was published at the end of May of this year. And this Health Affairs article said that between January 2008 and December 2010, if we don't make progress on health care reform, 6.9 million people will lose health coverage over the course of that 3-year period. And as you can tell from the number on the ticker, there are already more than 3.4 million Americans who have lost coverage since January of 2008. Just so that you understand how significant this is and how many people lose coverage with different delays, for every month, almost 192,000 people lose health coverage. For every day that we don't get health care reform, 6,301 people lose health coverage. Every hour, 263 people lose health coverage. And every minute, more than 4 people lose health coverage. This ticker will be in Washington in prominent places until health care reform is signed by the President. And it will be there as a reminder that there is an enormous cost for delaying or denying health care reform. We need to get it done, and we need to get it done this year. So I thank the 2 senators for their leadership, and we look forward to actually them being in the Rose Garden with the President for the signing of health reform.